The project is looking at the delivery of occupational therapy to stroke survivors in care homes. That's residential homes as well as nursing homes. And at the moment in the UK, stroke survivors don't get much rehabilitation, if any, in care home setting. So this project was to look at the impact of providing focused occupational therapy to stroke survivors in this setting to see if it had any benefits. And what we were really looking at was focusing on self-care tasks such as washing, dressing, feeding, looking at how the patient is sitting in a chair, if they get the right appropriate environment to maximise their function. And we've also been looking at mobility. So very basic things in this client group, but things that are essential for any good quality of life.
Research has shown that currently, I think occupational therapy is only accessed by about 3% of people actually living in care and nursing homes. And often just simple, small things or suggestions can really make a big difference.
There are a lot of barriers for care home workers to be able to support people to do more for themselves. So we wanted to develop a workshop that would take into account the sort of obstacles that they have to supporting people. So when we developed the workshop, we wanted to make it realistic, something that care home staff could feel confident that they could realistically implement the things and that it was relevant to them.
It's quite interesting actually. You know, you don't realise until you go on these sort of courses what you're actually dealing with. I learned a little bit more than what I thought.
I think that the project itself has raised the whole healthcare community's awareness of the need to improve stroke specialist care in care homes. And that's important, even if they're not going to get much better than they are, but to maintain their abilities and their ability to participate in life, really.
My husband's a very active man and he had this stroke and he was in hospital and they gave him physio to help him. And then when they got his home, the physio's finished and they do help him to stand, but of course they are not physiotherapists, are they? So the more they know, the more knowledge they've got. It's better for them and better for the patient.
I think this project will lead to a better understanding of the role that rehabilitation and occupational therapy can have in a care home setting. Whether we have a positive outcome that it makes a fantastic difference or it doesn't, I think we will have much more understanding about the dynamics and how we can work better within this setting and improve the quality of stroke survivors' lives.